Hi, I'm going to discuss one of my patient's story with you today. She is a 65-year-old female. She's very active in her entire life. For the past 25 years, she has been doing yoga almost every day. Apart from that, she used to walk 30 to 40 minutes, plus a little bit of gardening and all the household chores as usual with any South Indian ladies. She's very active, energetic, and very positive in her life. Of late, she has been having difficulty in doing her same yoga. She's unable to do the Patangasana. She's unable to do Surya Namaskar. Even she's unable to bend and tie her shoelace or wearing socks. She was not able to sit in the Padmasana position. Every time she attempts so, she gets more pain. In spite of doing multiple yoga stretches and other stretches, she was having difficulty in doing those yogas. Nights were getting slowly difficult and difficult. She wakes up in the middle of the night with the severe shin pain and the calf pain. And then she tried with multivitamin tablets. She tried calcium tablets. She met some doctor and took some painkiller initially, which was not helpful. And then she met me through one of her common friends. She met me, and then I analyzed her, and then she was worried. In spite of she being very active and she being very much of yoga fanatic, she still is having pain. So she wants to go back to the yoga, and then she thinks that that's one thing that will keep her active for the entire life. But unfortunately, she's unable to do that now. She was asking me questions why it is the case for her, in spite of being very active for the entire life and leading a healthy life, still she was having a pain. The pain nature, it was gradually in onset. It was not one fine day, just everything started. For the past 10 years or so, she used to get on and off back pain, plus a little bit of thigh pain and foot pain. And then it used to go, she takes rest, and then resumes the yoga, resumes the walking. Again, she will fall ill with the pain. So the cycle was going on like that. And this time, the pain is not going away at all. And more importantly, the nights are getting difficult. And even walking, she's not able to walk more than 5 to 10 minutes without pain. Coming out of the car is getting difficult. I did some comprehensive evaluation of the spine and then the legs, muscles, nerves, joints, and so on. We found that there is no issue with the joints nor the muscles. Then we identified that the problem could be in the spine because her SLR was positive, and then she was having pins and needles, and then a little bit of numbness sometimes. So all indicative of neural symptoms. So we suggested her to do an MRI, because sometimes it's better that if the MRI is done, both the patients and the doctor can be in the common page. We can exactly understand, okay, this is the problem, this is not the problem, to rule in certain things, to rule out certain things. So I'll be discussing her MRI findings now. Here is the MRI. Here is the MRI of the patient. What you are seeing is T2 weighted sagittal slice. You are seeing from right to left. As I scroll the images, in the mid-sagittal view, you could see diffuse but significant disc bulges happening in the lumbar spine area. So you could see this is L2 and L3. Here is L4, L5, and S1. The bulge is more predominant in L2, L3 region, which is literally causing spinal canal stenosis. And at L3, L4 level and L4, L5 level, you could see the disc is almost kind of degenerated. So a degenerated disc will become an unhealthy disc, and that cannot transmit the load properly. So that load will be transmitted to the facet joint, causing secondary facet joint arthritis. At the same time, the degenerated disc also will become a bulgy disc, and you see that the bulging disc is also causing the nerve compression over posterior aspect. So this is L3, L4, and L4, L5. In the L4, L5, you see the problem is even more severe. Literally, there is a bone bridging happening in this area, and the bulge is over here. So this is what the patient has been having since a long time, because what you see as the bulge here, it is not an overnight phenomena. No disc can bulge overnight like this, what you see. Month after month, year after year, decade after decade, the condition will be slowly worsening. But these patients will not know that it is a disc which is causing the pain. All they know is the muscle is hurting, muscle is tight, pins and needles, pain in the legs, because the conscious part of the brain does not have any capacity to estimate or recognize what is happening in the spinal canal, because the brain does not have the capacity to recognize or acknowledge what is happening in the spinal canal level. All the brain knows is the consequence, which is either radicular or the referred pain. Let me compare the same with the axial view. Let me open some axial picture for you. So here is the comparison of axial picture corresponding to the same sagittal picture here. The line what you see here is corresponding to this level. So this is L2, L3 level where you could see this is the disc. Here are the spinal nerves. This is the facet joint. You could already see the facet joint is undergoing some hypertrophy. Here is the bulge, which is bulging posterolaterally, causing more of right side compression of the what do you call lateral recess. And then as I scroll down, here you could see the canal is fine because it's in bony level, there is no disc bulge. But as you come down towards the disc, you see this, though the disc is kind of bulging less in the L3, L4 level, but what you see is here is the diffuse circumferential bulge, which will not be seen clearly in the sagittal view. Only in the axial view like this, you can see the circumferential bulge, which kind of fully narrowing both the canals, causing compression of left nerve as well as the right nerve. So when the nerve is compressed in this level or in this level, again, the patient will feel the pain in the legs. If the L3 nerve is getting compressed, the patient will be getting more of knee pain. If L4 or L5 nerve is compressed, the patient will get more of leg pain and the foot pain. These people will be having foot pain when they wake up in the morning. Here, the disc has undergone severe desiccation. That means the substance is lost here. So there is no substance to bulge here, unlike in the other level. Here is kind of degenerated, but substance is not lost. So it is able to bulge more here. Okay, so this, what you see here as the bulge here is corresponding to what you see here. Okay, so this is the reason for the patient's pain now. The patient's SLR is positive, prone knee bend test is positive. When she coughs and sneezes, sometimes she gets pain in the knees, and then she gets early morning back stiffness. In the night, when turning in the bed, she's having pain. So all these features are indicative of discogenic back pain, which can compress the radicular pain, because the discogenic pain can be causing local referred pain in the back and the buttock region. Once it touches the nerve, the pain will become radicular, and then the pain can go into the legs, foot, thighs. It depends upon which nerve is compressed. If the L2 nerve is compressed, it can even cause groin pain, and people think that it's a groin-related pain, wherein it can be coming from the L2 nerve. So if you see the bone here, let me zoom in. Here is the lateral view or the sagittal view of the same lumbar spine. You could see the end plates are kind of fissured. There is no smooth margin. You see, what you see is the smooth margin. That means the end plate is intact here. But if you see above here, the end plates are not so smooth. It's all fissured, and it can cause end plate fractures. Once end plates are fractured, the disc material can go up over the bone, and then it can cause inflammation of the bone. It can cause cyst in the bone. It can disrupt the blood supply to the bone. So what you see as the shady appearance over here is called as modic changes. Modic changes is again one of the consequences of disc degeneration, which causes even bone-related pain. So these modic changes can be the reason for vertebrogenic pain, or the pain which is emanating from the bone itself, which will be more of local pain in nature. But in this case scenario, the patient is having modic changes, in-plate fracture, disc degeneration, disc desiccation, diffuse disc bulge, as well as a severe nerve compression. So this patient will be a combination of all the symptoms which one can get as a result of lumbar disc degenerative disorder. Now it's very difficult to treat it, because we don't know whether this one is causing pain, or this one is causing pain, or this one is causing pain, or the modic changes are causing pain, or in-plate fracture is causing pain, or the nerve which got irritated because of the disc bulge is causing pain. It's very, very difficult to establish the connection between the pain locality and where the pain is coming from. In some areas, these are all parasagittal. You could literally see the osteophytes are happening in the paracentral area. This is called as disc osteophyte complex, because wherever the disc bulges, the bone will try to capture the disc, and then it creates osteophytic changes over here. So this can act like a spike, and then it can poke the nerve. That can really, really cause radicular pain. The patient's symptoms are unable to bend forward and touch the toe, unable to lift the leg, unable to wear the pant, unable to put the socks, are all actually because of neural tension. So the patient does not know whether the tension is coming from the nerve or the muscle. For any normal patients, it's always the muscle. They think the muscles are tight. Okay, and then they further do stretching. Yoga teachers will have no idea about all these anatomies and physiologies and pathophysiology of degenerative disc disorders. All they know is if it is tight, you have to stretch. If you stretch more and more, it becomes loose. Okay, that's all their logic is. Okay? Unfortunately, the philosophy of the yoga does not gel or sync with the pathophysiology of the degenerative disc disorders. That's why I'm not so optimistic about yoga teachers claiming that they can cure any pain because they don't know anything about pain. The pain is a symptom. Every symptom is for a diagnosis. So if you don't know to make a diagnosis, better don't treat them, because if you just simply treating the symptom, then anyone can become a doctor. But if you can diagnose what is the reason for the pain, then you become a real doctor. All right. So when it comes to the low back pain is a symptom. That means the body is telling you that something wrong with you. Okay. Instead of simply treating the pain, you need to make a diagnosis. As a physio, we make diagnosis like degenerative disc disease or disc bulging or disc herniation or spinal canal stenosis or fascial joint arthritis, or is it a myofascial pain? Is it a referred pain from organs? Is it related to the tumor or TB or osteomyelitis? There are hundreds and hundreds of reasons for back pain, but everybody are just thinking back pain as a back pain. They are not even thinking what is the reason for the back pain. Okay, so if these people go back to the yoga and do because 70% of the yoga is literally forward bending. When you do such Surya Namaskara or Patangasana or or any forward bending yoga postures, whenever the spine is bending forward, the disc will be further bulging backwards, because the disc naturally is like that. When there's a forward bending stress happening in the back, the disc will be bulging backwards and it causes more and more pain. So that's the reason why most of the back pain triggers are when you're doing forward bending, like lifting your baby or wearing a pant, or when you're taking a mug of water from the bucket. Those are the instances when the back tend to give up. All right. So the most of the acute back pains will be starting with a small trigger, and those triggers are all flexion based or forward bending based triggers. This lady, in spite of doing 25 years of yoga and leading a very active lifestyle, having a very good metabolic health, she still is suffering from pain. Means we need to have answer for this. Okay, why someone can have such kind of pain in spite of being very active and doing yoga? Our spine does not know whether you are doing Zumba or karate or yoga or dancing or nothing. The spine knows only one thing, that how much is the vertical compression force, how much is the forward bending force. If the compression force and the forward bending force are more than what it can tolerate, it can start to degenerate and it can start to bulge. Again, biology plays a huge role here. Not everyone will get the same bulge, but some are biologically little predisposed. Little bit of genetic tendency is also there. Little bit of inflammatory tendency, they'll be having more. So those people will be actually suffering more than the others. So when someone is able to do everything and not having the pain, it's fine. But that's a biology. But the nature of the problem is this only. If you're doing a lot of forward bending stretches or forward bending exercises or forward bending yogas, okay, thinking that you're going to stretch the muscle and loosen the muscle, you will become all right after that, which is wrong. Can yoga cure back pain? No, it cannot cure any back pain, because yoga is not a medical science. Yoga does not do any diagnosis. Yoga teachers are not doctors. They don't know anything about anatomy, physiology, pathophysiology of any problem in the medical science. So they can stretch you, they can motivate you, they can make you breathe, they can make you do the mind-body connection. For that purpose, if you want to do yoga, if you want to have mental calmness, you can do it. But when it comes to the medical problem like pain, get the pain diagnosed by medical practitioners. Apart from that, no amount of massage and oil application or detox or pranayama or meditation or spiritual praying, nothing of that sort will be structurally going to change anything here. Maybe you feel peace of mind, you feel happy about it, or you feel satisfied about the treatment what you got, but the problem will remain the same. Physiotherapist, orthopedician, and the neurologist, okay, they are the authority to diagnose the back pain. Okay, so when it comes to the back, think logically, meet a doctor, get it diagnosed, and then get the right treatment. All right, thank you.